Good afternoon. My name is Carla Smith, and today I will be talking about maternal health and pregnancy outcomes. There are thousands of women who go through pregnancy daily, and they are expected to have a healthy pregnancy outcome. But that's not always the case, unfortunately. CDC states that the United States has one of the highest maternal mortality rates across the country. And I wanted to talk about today how improving maternal health is so important, why increasing access to prenatal care is important, and addressing disparities and improving education can lead to a healthy pregnancy and a better outcome. For prenatal care, it is one of the most important factors of a healthy pregnancy. Why? Because healthcare providers are monitoring both you, mother, and the baby, and that's throughout the whole pregnancy. It helps detect early complications, which could be things like high blood pressure, gestational diabetes, or preeclampsia is even one of the things. So, according to American College of Obstetricians and Gynecologists, regular prenatal visits can help prevent serious health problems and improve outcomes for both mother and the baby. However, like I said, not all women have access to this, and this is why we must improve access to prenatal services by expanding healthcare services and coverage, increasing availability of providers, and to make it more affordable so women can have a good pregnancy, reduce the stress, consistent care throughout their pregnancy, and avoid complications. Second, I wanted to talk about was addressing racial and social economical disparities in maternal health. According to CDC, Black women in the United States are 2 to 3 times more likely to die from pregnancy-related causes than white women. This is not due to biology. This is due to unequal access to healthcare. It's a bias thing, and it's social inequalities. And this shows that maternal health isn't just about a medical issue, it is a social issue. So every woman deserves to have the care, attention, and respect that they are deserved during their pregnancy. And regardless of their race, background, addressing these disparities is essential because it's improving maternal health outcomes across the country. To address this health care, we must take action by reducing bias in medical treatment, which will be done by giving healthcare providers more training to ensure all women get the care they need. If there's more training, then it's more of a notice of the problem and it can be stopped. Finally, I wanted to talk about the system, the support system, how that plays a big role in improving maternal health. When women are educated about their pregnancy, they are more likely to recognize warning signs and seek help early. Knowing symptoms such as severe headaches or chest pain, swelling anywhere can make a major difference. And according to the World Health Organization, education and access to information can significantly reduce pregnancy-related complications. Support systems help reduce stress, which is important because stress is something that can negatively affect mother and the baby. When women feel supported, they are more likely to attend their appointments, they're more likely to follow medical advice, and they're more likely to advocate for themselves, which is what we want them to do. And doctors, healthcare providers should take the measure to educate more awareness on this situation so women feel empowered to understand their body and advocate for themselves throughout their pregnancy. Because when you don't speak up about something, and it can be something so little, but you don't feel supported enough to advocate for yourself, that can be something that is a bigger problem than you think. So, for maternal health, it is more than just about pregnancy. It is about protecting lives. By improving access to prenatal care, addressing disparities in healthcare, and increasing education, we support can create safer pregnancies for all women. Having that support can create a safer pregnancy for all women. And because every mother deserves to have a safe environment, every mother deserves to go through a safe pregnancy and just have access to care for mother and the baby. Thank you.